Joined now by the journalist Michael Shellenberger, who released the WPATH files to the public. Michael, thanks so much for joining us. Okay, I'm sure I'm going to know the answer. How did you get these files and these videotapes? It looks like excerpts from a Zoom meeting.
Yeah, that's right. Well, first, thanks for having me on, Elizabeth, and great segment. Somebody or some people gave me the files, and I'm not going to be able to say much more than that. I think it's important to protect my sources. But they are authentic, and there's been, we've had some communications now from WPATH, and nobody has suggested that they're anything other than what they appear to be. And I think really what's dramatic here, because certainly, as you mentioned, there's been concerns raised in the past. I think what's so significant here is that we have WPATH members, practitioners, and leaders acknowledging that they're not getting informed consent from the children, adolescents, and vulnerable adults for whom these procedures are, on whom they're being performed. That's extremely significant. That's a breach of basic medical ethics. It's right up there with do no harm, is that the people that are getting these treatments must understand what's happening to them. And the files show very clearly that that's not what's happening.
Well, very clearly, at least in what we just saw, and at least one, I mean, I don't know, we don't know what percentage of the cases are like this. I mean, we don't know if that was one person, one child out of, 100 or 10 or 1 million. But as the doctor was saying, they haven't even had high school biology yet. They don't understand any of this.
Yeah, that's right. And yeah, there's a big debate over how many or what percentage of folks that go through what's called gender medicine will end up regretting it or seek to so-called detransition. But I think what's important here is that it clearly shows that there is no scientific or evidence-based standards of care from the organization that claims to be promoting standards of care.
All right.
There's something called the medical chain of trust, which is that doctors need to be able to trust that what they're recommending is based on science. And this clearly is not based on science. They're making it up as they go along. There's not the kind of, peer-reviewed control group, long-term studies that you would expect to see from some other form of frankly, very radical surgery and medicine.
Life-changing. All right, Michael Shellenberger, thank you so much. Really appreciate it. Thanks so much for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.